What happens if you retain urine for long? What are the side effects of keeping urine? I am talking about the inability to empty your bladder for longer than 12 hours. There is no reason for a man or a woman to retain urine, to hold it, especially when you feel like going to urinate, the urge to urinate, and then you tighten it for one reason or the other. Here, the experience I have personally had has been inside the vehicle, the bus, traveling from one town to the other. Long journey. Worst of all is when I moved from Bamenda, here in Cameroon, to the north, and even moving to the far north. That was to Marwa. And it took us 3 days, and almost 4 days, from one town to the other, continuous journey in a bus, big bus, 70-seater bus. At one moment becomes so boring that you can even get sick and get well, and when you are still on that journey. What about those who just live only one town to the other, and it's a travel overnight, more than 8, 9, 10 hours? You see, a lot of people feel like urinating, and they hold it, that they don't feel comfortable urinating out of their houses or out of the home. When you feel like the bladder is full and you do not quickly make way to urinate, there is a consequence. There is a negative effect. This video looks at it. Ladies and gentlemen, I am Dr. David Ayim in Bamenda, Cameroon. You are reproductive health expert. This is the topic we are talking today. It is very serious, especially affecting your reproductive health, where it concerns me most, to be able to teach you. Number one, when you retain urine, you stand the risk of urinary tract infections. When urine stays there for long, that's the risk. Number two, you face the risk of kidney damage. When your kidneys are not draining well, if your kidneys take the time to form the urine, and then you allow the accumulation, the bladder is full, extended, and then you are not eliminating, and then the kidney cannot properly drain the waste. If you continue to do this, before you know it, your kidney is bad. If they start telling you that you will going for dialysis from every week, every time, then you will understand the risk of keeping urine for long. Number three, damage of the bladder. That same bladder becomes so tense, the pressure inside increases. When you feel like urinating, the bladder is full. Do not strain that bladder. You risk damage. Of course, number four, lower abdominal pain. You will find even a man start complaining of pain in the underbelly. Have you urinated? Have you emptied your bladder? This is one common cause of such pain in the pelvic floor. Number five, a full bladder has a negative effect in pregnancy. In fact, especially during labor. Some women will labor, and they will tell that the contractions are coming fine. They will tell that the cervix is dilating well, but the descent of the presenting part is not going well. There is delay. There is a protracted, labor there. especially the second stage. In most cases, check the bladder, my dear brother. She might not have passed urine, even in the space of 4 hours, 5 hours or more. Then the midwife or the nurse or the doctor is forced to use a catheter, a urinary catheter, to empty the bladder. And then when the bladder shrinks, because it is now empty, it gives space for the womb. It gives space for the baby to come out. And it means that it may facilitate the birth process. Do not keep a full bladder because it causes obstruction in the delivery process. Now, number 6, a full bladder can cause subinvolution. This is in women who have already given birth, and now the uterus, the womb, after delivery, especially within the first few weeks, the womb begin to return to its pre-gravid state, back into the pelvic cavity. Your womb may delay in returning. So a delay in this involution process, we refer to it as involution of the uterus after delivery. So a woman could give birth, leave the hospital, come back with a baby, and she may now start complaining again of pain in the lower abdomen. She may now start complaining. Before you know it, infection is setting on, and the signs will be fever. Okay, in the puerperum, in the period, few weeks, few days to few weeks after delivery, and you want to check or palpate the abdomen, it's still bulky. When the involution process is slower than normal, we refer to it as subinvolution. Sometimes only, a full bladder is responsible, preventing it from involuting well. So you can see, even to women in the process of delivery, a full bladder can cause danger. Some of the women and the men are even aged that need to make sure they empty their bladder once within 3 to 4 hours. Once within 3 to 4 hours, which is even safer. But it is not good. Please, we tell you, no matter what, do not keep urine for more than 12 hours. It becomes a great problem. Number 7, you will be having cramps. Cramps. Apart from the lower abdominal pain, you have cramps, especially in the legs, down, especially on the thighs, and then under the thighs. And you begin to hit that, pop, 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 pop. You're wondering why a lot of cramps. Your bladder may be too full. You might have retained urine for too long. Number 8, urinary incontinence because of overflow. If you allow your bladder to retain urine for too long, you might notice that you suffer inability to hold it anymore. It begins to drain out on its own. You wet your dresses. Do not get to this level, please. Watch out and stay healthy. If you are not subscribed yet to our channel, please do subscribe, like, and share. You can make comment and even ask questions on the comment section, or you can write on WhatsApp following the number +237 694 353141. Have a nice time.